for surgeries, specifically linked to the Cuba eye care program at St. Joseph's. I want to go into that for a bit. The Jamaica Cuba eye care program will continue. That's the intention. Its operations will continue by the Cuban team up to the 20th of March. There's an agreement on that. And for the remainder of the program's operations, services will be limited to surgery and post-operative care. Now, what this means is that for surgical procedures for patients who are already scheduled and follow-up care for patients who have already undergone eye surgery and retina-related post-operative treatment and monitoring. So those who are prepped for surgery, and I think the number I got was about 130 something, 140. Those procedures will take place. So those who have those appointments, not to worry, that will take place. In addition to that, the post-surgery care will continue under the program using the same staff, Cuban healthcare workers, up until that time. Patients, therefore, who previously received surgery under the program are encouraged to attend their scheduled follow-up appointments to ensure proper recovery and continue care. In the meantime, we are working, and I've started that, on alternative arrangements to ensure the continuity of the screening program through a combination of our internal capacity as well as through some outsourcing arrangements. And we have got the cabinet's agreement on that. Agreement in the sense that it has a budgetary implication, meaning engaging the private sector. So I think it's important to say that we understand, fully appreciate the benefits of the eye care program at St. Joseph's. We know many Jamaicans have benefited from this, and it has been driven primarily by this agreement involving the Cuban workers. The intention is not to discontinue the program. The intention is to work with the existing team up to the point when they may discontinue or continue, depending on where the discussions lead. And beyond that, to find alternative ways to continue the work, because it's a very critical program through the methods that I've outlined earlier. In terms of the medium term, the ministry is advancing its recruitment drive, and we have had several areas that we're exploring and pursuing. So you may recall that we had advertised in the diaspora for Jamaicans or others who may want to apply to take up specialist posts in Jamaica. We got 130, just under 140 applications. We have shortlisted those to 70 specialist nurses from the diaspora, but also beyond the diaspora, other countries. And that's 70, ranging a range of disciplines, are being scheduled for interviews through the HR department at the ministry's corporate office. So in the coming week and a half or so, we will begin the process of interviewing. And the idea is to fast track the engagement of those persons. So these include some nurses who are working in the UK, Canada, US. It involves persons as far as Ghana, where they have an excess supply of healthcare workers, and I'll get back to that shortly. And so we believe that the ads for persons to look to Jamaica, particularly diaspora members, has been successful to a point in that we've gotten some numbers with interest and good credentials, and we're going to be pursuing that in earnest. And we believe that will fill some of the gap within the medium term meaning within the next 3 months or so. We're also expecting an additional 48 nurses and 33 doctors who are recipient of the Barwin Scholarship. That scholarship is now in its second year, third going this year, 3 of 5 years. You remember that scholarship was announced to do exactly what we're trying to do now, to train Jamaicans who qualify in areas where we have gaps and integrate them back into the system because they're bonded for at least 3 years. We will begin to see the results of that this year. because some had 1 year, some had 2 years, depending on what their training was and where they were with their training. And we will see some benefits there. 48 nurses, 33 doctors, and doctors not necessarily MDs, but persons pursuing other areas of specialization where the gaps are. And we're hoping that the Barwin Scholarship would start to bear some fruit in terms of getting people back into the system during the course of this year. We also have 100 nurses currently enrolled in our specialist nurses program. This is our in-house training, which is driven by the Ministry of Health. And they will complete their studies this year and be promoted to their areas of specialty. And this year meaning June, I believe, sometime June and beyond. October, okay. So that will also bolster some of the shortages that we have. The ministry is also in an advanced position in our negotiations to conclude MOU agreements with Ghana and Nigeria. Now, you will recall that the Ghanaian foreign minister was here recently. We had a communique which indicated the strong interest. Ghana is one of those countries that has an excess of nurses. It's a similar training protocol. And we have signed off on the MOU. The MOU is now with them, but we are encouraged by the feedback. And we believe that we could quickly turn that around over the medium term meaning within 3 to 6 months, to see those specialists where we have gaps filling that. And the same for Nigeria. And so we have targeted the end of March to sign the MOU and start the recruitment of specialists. You will recall I had gone to the Philippines and India last year, and we have signed a memorandum of understanding, and now we are having discussions around a training program for specialist nurses in the case of the Philippines. There's a technical team that should come to Jamaica soon. And in India, those discussions are ongoing. Having said that, those are bilateral discussions. We have also gotten Cabinet's approval to do direct recruiting through private initiatives, meaning recruiters. It's not unusual. And the connections and the network that we have established allows us to do that. And we will be pursuing that also to ensure that we shorten the gap between recruitment and getting persons in the system. Finally, for the long term meaning during the course of the next financial year, we have gotten Cabinet approval to move to another level of our strategy around international recruitment. And that decision is supported or bolstered by Cabinet's agreement for us to establish an international recruitment unit within the Corporate Services Division of the Ministry of Health and Wellness. And that unit will serve as a central coordinating hub to all international recruitments, including recruitment under bilateral cooperation and within the diaspora. The unit will focus primarily on where there are gaps, shortages. It's not an attempt at replacing persons who are in the system or who are being trained for the system, but where the critical gaps are, and the specialized fields in nursing, midwifery, intensive care, and other priority areas. Now, that has been a build-up. Many of the discussions that we have had, some of the things I've said publicly in the past, that we have to bolster our capacity to train, which is why Barwin is in place. We have to provide an opportunity for diaspora members to come back, which is why we advertise and are going to be doing the screening of those who have. But we also have to recognize that in an environment where there's a chronic shortage of labor in specialized fields where lives are at stake, we also have to open ourselves up to where recruitment can bolster and enhance the public health system through the HR function. And as we build hospitals, Spanish Town, Cornwall, Western Child, we're going to have to seek the HR potential that exists anywhere in the world as long as they meet the standards to provide quality of care. It's the last plank in the expansion program. And I just want to reassure the country that the government is very seized with this, and the decision that has been taken by cabinet supports this position. So in conclusion, I want to reassure the public that from health's perspective, we understand the anxieties among some who may be directly impacted by services provided to them by a Cuban healthcare worker, whether at the primary, secondary, or indeed at the Cuba Eye Care Program at St. Joseph's Hospital. We fully understand that. And today we know that members went to St. Joseph's. Some may have expressed some concerns, but instructions were given to continue with the program, continue to register for screening, and the intention is to try to work within a time frame, within the new arrangements, if nothing else changes in terms of Cuban workers staying here under the new agreement that is being proposed, to continue that program and indeed to bolster it over the medium to longer term with all the decisions that have been taken. So I'm not saying it will be easy because there are overtime requirements and wear and tear on local staff will be a challenge in some areas. Sometimes you may experience some delays, but we have a plan. We're working the plan, and we believe that any disruption that may be caused will be overcome in a relatively short period of time. Thank you very much. Any questions?
All right. Thank you very much, Minister. So I'm asking our media colleagues to use the raise hand feature on Zoom and wait to be acknowledged. You can pose your questions. We have Kirk Wright from TVJ. You can go ahead, Kirk.
All right. So my question is, are individual contracts being offered to these Cuban healthcare workers? And if so, what percentage of them are taking up these contracts?
So the conversation continues. It was very explicit when we announced the discontinuation of negotiations that those Cubans who are here would be offered individual contracts if they so desire. It's entirely up to them. And so it depends on what they say and what they're willing to do. Or we are offering the opportunity for them to remain. We have said that many times. And depending on the interest expressed, then we will proceed. What Cabinet did today was to give the go-ahead for those conversations to pursue in earnest and with any specific requirements that are necessary to support that new arrangement.
All right, Siobhan Campbell from Nationwide.
Good afternoon, Dr. Tufton. I have two questions. The first is, to what extent and how far back were you aware of the alleged illegal practices under which the Cuban professionals were engaged, for example, not collecting their own salaries and not in possession of their travel documents, considering this program has gone across multiple administrations over the past 5 decades?
I'm not. I hear how you frame the question, and I'm not. My focus today is on ensuring that the health services are provided with adequate personnel to deal with the challenges. The issues around, when you are aware, when you are not aware, I'm not sure it does any value to where we are now. At the end of the day, we have to serve the people on the ground, whether at St. Joseph's or elsewhere. There are issues with the existing agreement as outlined. There's an attempt at renegotiating. We have been at it for, I would say, over a year, beyond a year. So that may give you some indication as to from when we have been trying to adjust. The conversations have been ongoing. They've been cordial. They've been cordial because we are very grateful to the Cuban government for the program and the workers who are here. And the relationship has been very good. But the truth is those negotiations have stalled in terms of a kind of follow-up and response. As a consequence, this is where we are. So focus right now is how we move forward, and I'd prefer to keep it there.
You have a second question, Siobhan?
Yes, actually, then more directed to that point, how will the disengagement of the Cuban healthcare workers impact the reopening of the Cornwall Regional Hospital as well as the Western Children Adolescent Hospital in terms of staffing and other concerns?
It won't have an impact. The Cuban healthcare workers who are here have served an important role. Their role was specific to certain services based on where the critical shortages were or are. Those areas are across the board, but confined to particular services and would bolster existing capacity in those services. So where Jamaicans are, but not enough. Sometimes it's rural because some Jamaican doctors may not want to go to work in a rural parish. Sometimes it's specialization like oncology, cancer care, which is a growing area, or lab services. So the intention is to focus on those areas with the plan as outlined, whether it is the search plan in the short term or the recruitment plan in the medium to longer term. And we believe that we will just have to be more aggressive in doing so. Maybe we should have moved faster. I think that's fair to say. Some people may want to say that over many, many years, not just over the last 5 years or 10 years for that matter, because, you know, the Cubans were present and available. But we had and have been pursuing a plan. I've spoken about it several times for expansion. And we are anticipating Cornwall, Western Child, Spanish Town, and the plan that we have been pursuing for those, the HR plan, have been in effect. So we believe we'll be able to continue on the trajectory and the timelines as outlined.
All right, I have a question from Emma Lewis.
Yes, good afternoon, everyone. I just want to kind of clarify something in my mind. I understand there are two separate agreements, one for the eye care program and one for, you know, other services. But is it that the Cuban eye care program will continue until March the 20th, and then all the Cubans workers there, because it was entirely run by Cubans, will leave, and then what happens? I wasn't quite clear on that.
No, right. So what I actually said was that we have a plan for the worst case scenario. But that scenario has not yet played out because there is an offer for those who wish to remain under a different agreement. So depending on what happens over that period of time, then we will determine how our plan, you know, pans out. So yes, it's a little unclear in terms of who may be interested to take up the offer and what process we engage in to do that as quickly as possible. But we are appreciative of the Cuban government and those who are here for a timeline that is specific. So we know that we have until the 20th of March and things will remain as normal. What we are committed to do as a government is to continue the eye care program at St. Joseph's Hospital. So whether it's administered by Cubans, Ghanese, diaspora, Filipinos, or Jamaicans, we are committed to the program. And I think that's perhaps the most important thing that we should outline to the Jamaican people who want to be served by the program. Don't panic, don't stress. We're going to work on the program. We're going to work to ensure the program continues.
All right, we have a question from Television Jamaica.
Hi, afternoon, it's Jamila. To the minister, what is the take-up like, the individual contracts since being offered, and how confident is the ministry that the healthcare workers will take up some of these individual contracts? And to the CMO, the Cuban eye care program is supposed to end on March 20, but there's another contract, as Emma Lewis had said. What is the biggest gap period that you see as it relates to their work permits. So say, for example, majority of the work permits, I know they have different periods. Let's say they end, for example, in April and there is no take up. Do you see a gap happening between April and when the government intends to recruit, for example, the Filipinos, the Indian healthcare workers, the Nigerians, the Ghanaians?
So thank you. Let me say that the conversations are continuing, and I don't think it would be appropriate for me to comment publicly on where we are in terms of numbers and so on, because I think we have to have discussions before we conclude on numbers. And it's a recent offer, and there has to be some time allowed to determine where we go and where we will end up. So I prefer not to say, except that there's an offer. There's a conversation that's taking place. I believe even at the diplomatic level also, there's a conversation. So we are concerned with the health services and ensuring that we protect, preserve, and indeed, based on the longer term plan that we have had, expand those services for in the interest of the Jamaican people. Simo, you want to comment on this?
Yes.
Here.
Yeah. So, of course, we're going to try to ensure that there is minimum kind of deficit that is there. And the first thing that we are trying to do is to see how we ensure that proper resources are within the government facilities in order to continue services. So right now, we're doing a gap analysis in terms of what is needed within some of our public facilities. We have ophthalmology offered at the Kingston Public Hospital, Mandeville Regional Hospital, Cornwall Regional Hospital, and at the University Hospital of the West Indies. And immediately we are now looking at to see what is the gap that is there in terms of their ability to take up some of the slack. And we'll be looking to ensure that we provide the resources for that. We also have to look at arrangements in terms of outsourcing some of these services to whether it is that we can get persons to come into St. Joseph's Hospital to be able to continue the service there so that there is no break, or whether it is that we find services that we can channel people into. But those are some of the areas that we're exploring at this time to make sure that we don't have a gap.
All right, thank you.
Yeah, I was about to call, Miss, just about to shout.
Very much, Simo. So we'll ask Dwayne Anderson. You can unmute, please.
Yeah, good afternoon, Dr. Tufton, and good afternoon to the members at the head table. Dr. Tufton, can you say at this time, please, what the offers are to some of the people overseas that you're trying to recruit, the professionals? We know that in some of these countries, the USA, Canada, England, for example, these people are extraordinarily well paid. They're lucrative professions overseas, and how it compares to the jobs out here locally, if there's a disparity. And if there's a disparity, are you concerned that local staff may be discouraged by what they're working for compared to those coming from overseas to work here?
Well, there's no intention to vary what are agreed rates and agreed arrangements within the public sector, except the routine and allowable adjustments that may cater to people who are relocating, and that is universal in terms of its principle and approach. Someone is moving back, if they're coming for a period, a contract, there are certain provisions that have to be made to cater to them coming in, and that would apply to anyone. So there may be some differences, but not generally speaking in terms of compensation, because it wouldn't place the locals at any disadvantage. You know, one of the things that we have to recognize, and I've said it many times, the environment is very dynamic. The world has evolved. And as it relates to healthcare workers, they are perhaps the most mobile in terms of the mobility of labor. Particularly if you're a specialist, you can go wherever you want. And it's not just North America, it's a Caribbean region, it's North America, it's Europe, it's Canada. Most of our healthcare workers who specialize end up in the United States. in some institution working. But there's another important point. Money is not always a driving force, even though it may be a big consideration. Quality of life is measured in more than just dollars. And there are many who have expressed an interest to return home because they feel quality of life, not just in terms of the paycheck, but in terms of the environment, the family, the friends, the comfort, that Jamaica is a better place for them. And the same, I believe, is the case in some of the other countries who have expressed an interest. So it's not always driven by money. What we have to do is be accommodating. We have to be good hosts. We have to protect those who come, give them good working conditions, and they must have some certainty. And we've been working on that, and I think we're in a position to offer that.
All right, thank you, Minister. We're gonna go to Sashana Small from Gleaner.
Hi, good afternoon, Dr. Tufton. The conversations that are being held to get new contracts for the health personnel here, are those conversations being held with the doctors and the nurses themselves, or is it being held at the embassy level?
Well, the offer has been made for individual contracts, so it would be up to the individuals to make that determination. So yeah, it really is up to the individuals. It's not, they will have to make, they will make the decision. So to the extent that they make that decision and indicate that, then we will pursue it further.
So you're speaking to the health personnel here?
The offer has been made to make to the individuals, if they so desire to stay, then we will be willing to engage them in direct contracting. Yes.
Okay, thank you, Dr. Tufton.
Yeah.
All right, thank you, Minister. Corey Robinson from the Gleaner. Corey, can go ahead and unmute.
Oh, sorry. You hear me now?
Yes, go ahead, please.
Okay. Right. Good afternoon, Minister and members of the team. All right. You mentioned the surgery and post-surgery care at through the eye care program. I was wondering what other services are offered in that program, as well as you mentioned that I heard it was mentioned that so KPH would be assisting with some of the shortfalls or the gaps. I'm just wondering, with KPH having such a vast number of these Cuban healthcare workers, what are some of the critical areas that KPH, for one, that will be impacted, as well as Bustamante Hospital as well?
So for KPH and for Bustamante, the main impact is going to be on nursing. At our larger hospitals, or type A and regional hospitals, and this includes University Hospital, KPH, Cornwall, Bustamante, Victoria Jubilee, St. Anne's-Bay Regional, and Mandeville Regional Hospital. That's where we would have quite a bit of the specialist nurses, because those hospitals have specialist services, including high dependency units, intensive care units, nephrology services, and other specialist areas. And so the biggest gap is going to be in terms of nursing in those areas. We do have at the larger hospitals some of the specialist services that are supported by the Cuban physicians, but our major impact in terms of physician shortfall is going to be in our smaller hospitals, where it is that we would have been expanding, steadily working to expand services in terms of some of those specialist areas. In terms of the KPH ophthalmology program, as I mentioned before, right now we need to do, and we have started to arrange meetings with the hospitals to look at the gap analysis in terms of what are the things that are needed in order for them to be able to carry out the service. And we have to look at all our public hospitals where ophthalmology is offered to see how we can boost their service. And I think out of every bad things that happen, there's always some good. And I think the good that is coming out of this is that we'll be able to concentrate on upgrading some of the services, providing the necessary equipment and supplies, and look at how we sustain that for ophthalmology in these hospitals that offer the service. We also need to look at our training institutions to see how it is that we can ensure that they are able to carry out their service as well.
All right. Thank you very much, CMO. I think those are all the questions, Minister. Do you have any closing remarks?
Yeah, well, I want to just use the opportunity in closing to thank those who have expressed concerns and to just reassure the public that we are working to address the issues in public health in terms of any gaps that are created. You would have heard some of those plans. Didn't want to comment too publicly on it until we had a cabinet conversation, which took place today, hence why I'm speaking now with more authority. But those plans had commenced sometime before. The short-term plans, certainly over the last week or so. The medium to longer-term plans were always at play, including some of the visits that we took, the ads that we placed, and the Barwin scholarship and so on. So we're not caught unprepared. That's not to say there are not challenges, because there were always challenges. And I don't want the impression to be given that you will not experience possibly some delays in different areas, because those challenges exist all along. We've always had a shortage in some of the critical areas. So it's a matter of how we work through them, and we ask for your patience to ensure that we do so well. And then very finally, I want to just recognize the Cuban government and people and the relationship under this program. It is a good program, has been a good program in terms of the services, and the offer is not to discontinue the relationship. Just to be clear, it's really about adjusting the nature of the program and how it is configured. And that is still very much the case in terms of the offer. So we will see how that plays out over the next few weeks. In the meantime, we'll continue to work, even with some different arrangements, to continue what we have in place in the service of public health. Thank you very much. Have a good evening.